Hello, everyone. My name is Carolyne Shander. I am representing Action Against Hunger. I am delighted to share insights and outcomes from a recent study implemented in Ethiopia and Kenya, aimed at tackling a critical gap in the humanitarian WASH: timely, reliable, and cost-effective water quality testing. This presentation is based on our field experience and evaluation of the WaterScope, an innovative water quality testing incubator that has been recently tested with support from the HEARO Humanitarian Innovation Fund. Action Against Hunger, in partnership with Order in Ethiopia and Yangat in Kenya, tested its adoption in drought and conflict-affected contexts. Water quality, particularly microbial safety, is a persistent public health challenge in humanitarian settings. While infrastructure solutions exist, our ability to regularly test and confirm that water is safe for consumption remains limited. Today, I will take you through how the WaterScope technology has been tested in challenging humanitarian settings and the potential to transform the way we detect and save water in such contexts. In terms of humanitarian context, the Horn and East Africa are deeply impacted by conflict and recurrent drought. This overlapping crisis displaces communities and forces them to rely on unsafe drinking water sources. In Ethiopia and Kenya, large segment of the population depends on rivers or unprotected wells, water sources that are highly susceptible to fecal contamination. In the area where the WaterScope was piloted, over 66% of rural population lack access to safe drinking water. Waterborne diseases such as cholera and diarrheal illness thrives in this condition. Often, the challenge is not just the absence of water, but the inability to confirm whether the available water is safe or not. The current unconventional water quality testing kits in emergency is plagued by problems. One, high cost of kits and consumables, logistical challenge to transport equipment, long incubation or processing times, lack of trained personnel. As a result, we are flying blind when it comes to water safety and in the places that need testing the most. WaterScope was designed to address these gaps. It's a robust, field-friendly solution for microbial water quality testing. Now, what is WaterScope? It is an automated portable water testing kit developed with emergency settings in mind. It uses a membrane filtration cartridge and incubator. It integrates with a digital microscope and machine learning image analysis. It identifies and counts E. coli and coliform colonies. It sends results via Bluetooth to an app or dashboard. It operates without constant power or internet. Field staffs do not need lab expertise. That is a huge benefit in emergencies where time, skills, and power resources are limited. The pilot project was funded by HEARO Humanitarian Innovation Fund from April 2023 to July 2024. We piloted in 2 different high-need districts. In Kenya, it was piloted in West Pokot, an arid, insecure with chronic wash needs. In Ethiopia, it was piloted in Sekota, a drought-prone, conflict-affected zone in the Amhara region. We asked, what is WaterScope usable? Does it improve decision-making? Is it cost-effective? The pilot combined training, field implementation, and evaluation with external consultants. We conducted joint missions with local water offices, non-governmental organizations, and WASH committees. This is building local ownership throughout the project. We also conducted evaluation. We adopted mixed methods approach grounded in field realities. We did quantitative and qualitative analysis. In terms of quantitative analysis, 774 water samples tested for E. coli across 4 rounds. We then compared WaterScope against Dilagwa, Potatest, Aquasafe, and laboratory test. In terms of qualitative analysis, 34 key informant interviews were conducted and 18 focus group discussions were also conducted. We used descriptive statistics, analysis of variance, and regression to evaluate sensitivity and consistency. We also analyzed the cost per test, ease of use, and feedback from field teams. The results were compelling. WaterScope detected significantly higher E. coli levels than other test kits, indicating better sensitivity. Regression showed strong correlation between WaterScope and both field and lab results. It also delivered fast results within 8 to 21 hours as compared to other available tests like Delagua and Potatest that shows results within 16 to 18 hours. With Bluetooth transmission and dashboard uploads, the results were accessible in near real time. The technology performs held up even in remote, low-resource settings. In terms of cost effectiveness, affordability is key to scaling. WaterScope is quite affordable than other traditional kits. The initial cost for WaterScope is about $1,500 US as compared to the available kits within the local market. The cost per test is around $3 to $4 US. That is cheaper than the available kits. Like Porter test, it's around $17 US, and with the government laboratory services, it's around $22. In terms of usability and user feedback, across both countries, WaterScope scored higher on usability. Field team said it was easy to carry, quick to learn, and produce actionable results. Local non-governmental organizations appreciated its automation and data reliability. Yes, the challenges exist, like cartridge supply issues and Bluetooth pairing bugs, but these were outweighed by its utility. The field teams consistently said it makes testing easier and more consistent than anything we have used. In terms of value and transferability, WaterScope integrates with WASH information management systems, allowing seamless data reporting. It aligns with emergency and development programming. Its size and function allow it to be used by non-governmental organizations, water offices, and even trained community committees. It's compatible with solar and offline use. For transferability, the pilot showed cross-country consistency and high performance in low connectivity. What we need to scale is to establish local supply chains, franchising and non-governmental organization collaborations, integrate international water safety plans, train diverse users from technicians to community. In conclusion, WaterScope is affordable as it reduces cost over 5 times compared to existing options. It's reliable, performs as well or better than locally available option. It's scalable as it works for NGOs, governments, and communities. We therefore recommend adding WaterScope into the available affordable technologies for humanitarian agencies and stakeholders, strengthen local distribution and consumable supply chains supporting efforts started by WaterScope in Ethiopia, fund integration into humanitarian wash system, as well as more regular community-level testing, advocate for increased water quality monitoring and use of the technology with national ministries and donors across new regions. It is an opportunity to strengthen the community-level accountability, speed outbreak detection, and protect health in some of the world's hardest places. Thank you.